Hi guys, welcome back to my channel. My name is Tiana and today I want to talk to you about things that you should bring with you to your clinical site. I know a lot of you are going back to school for the semester after a nice, wonderful winter break. You're going to start clinicals again. So now that I've been a nurse for over a year, I kind of want to update what I think you should bring because when I was in nursing school, maybe I brought too much to clinicals. So stay tuned. Okay, so most important things to bring in clinical, let's just keep it simple. You don't need to bring a whole big bag like I used to take. I used to actually take my backpack, I think, but you don't even need that. Listen, bring your stethoscope. Bring a small notebook that can fit in your scrub pocket. Bring a pen and a pencil. My favorite pen is the kind with all the different colors that you can pick. Sorry about the crinkling. I'm so sorry. But this is my favorite pen. I got a pack of three or four from Amazon for a very, very great price. Very affordable. Different colors. It has green, blue, whatever. All the essentials. So bring a pen. Bring a pencil, your stethoscope, a small notebook that you can take notes in, and that's it. That's really all you need. And you need to know three things. I always ask nursing students who are paired with me three things. So know the answer to these three things. What are you learning in school right now? What are you allowed to do with me? What are your goals for the day? I will always ask you those three things because though that information that I gather from those three questions will help me to create learning opportunities for you. So if you tell me you're studying the cardiac unit, then I can really take advantage of the tools that we have in our unit and show you all the EKG rhythms of our current patients. We have how many rooms? It shouldn't take me this long. We have 27 beds. So I can potentially show you 27 different cardiac rhythms on a monitor. Or I can pair you with Julie. She's our EKG tech. She goes around to the whole hospital and does all the 12 lead EKGs. I can pair you with her for 15-20 minutes and you can potentially see some life-threatening cardiac rhythms, which I'm sorry, I sound like I'm excited about that. I feel so compassionately and empathetic for our patients who are experiencing those rhythms, but it's great for learning. So I'm excited for your learning opportunity, not for our patients' life-threatening cardiac rhythm. Don't misinterpret that, please. And it's always good to know what you can and cannot do with your nurse. You don't want to put your nurse in a situation where she's letting you do something you're not supposed to be doing, because then you ruin the relationship between your school and the hospital, and that's no good, because then your school could be banned from doing clinicals at that site. And that's unfortunate. Don't do that. And then always have a goal. Whether or not your nurse asks you what your goal is, it's really important for you to have a goal in mind. It could be as simple as, hey, I just got signed off on inserting IVs. Can I insert IV? My goal for today is to insert an IV. Tell your nurse that. And that way we can create a learning opportunity for you. I've sent nursing students who were in the cardiac unit at school down to watch an open heart surgery. I've had students who were learning about respiratory observe intubations and extubations and then maintenance care of patients on mechanical ventilation. So always remember that you're only going to get out of your clinical rotation or your clinical day as much as you want, as much as you're willing to put forth. So if you show up looking excited and interested and ready to learn, then your nurse will create those learning opportunities for you. But if you show up and you don't really look like you're interested, you seem kind of detached and bored, then your nurse is going to let you sit at the nursing station until it's time for you to leave. I'm sorry to say it like that, but that's the truth. Show up, be engaged, and always remember, please always remember, when your nurse moves, you move. It's like that song, when I move, you move. When I move, you move. Keep that song in mind. When you see your nurse go, you go. And I have a story. It's such an unfortunate story, and I feel so bad about it. I was paired with this nursing student, very nice, maybe shy, because he was very, very quiet. So we got report at the nurse's station, sitting at the desk, and then I was looking up medications, and I got up to pass meds, and they said, okay, I'm going to grab some meds. He should have come with me, but he sat there. And so I went to the Pyxis, got the meds, went to my rooms, gave the meds, did the assessment, came back out to the desk to chart, and he was still just sitting there writing something. I don't know what he was working on all day. Unfortunately, I only had him with me for 4 hours that day. So it wasn't until we were 3 hours in and he was still sitting at the desk working on something that I turned to him and I said, what are you working on? Is that a care plan for class? Is it, what is it? What can I do to help you with it? And he said, no, it's not an assignment. I'm just interested in this patient and I wanted to do some research on her. And my heart broke. I felt like we had wasted the day, essentially. I had misinterpreted him being there quietly writing as him being disinterested and maybe trying to catch up on some assignments he may have been late on for his program. When really, he was trying to self-teach. I don't know why I stuttered just then. That was weird. But he was trying to teach himself what was going on with his patient when he had a great resource in me. I could have told him all of those things and I could have showed him things. And so at that point in that last hour, we really engaged and I tried to teach him as much as I could about this patient and the medications and how everything kind of fit together. And it was such a shame that it was a wasted clinical day. And I hate that. I love to give my students who are paired with me as much opportunity and hands-on as I can. When I have a nursing student, my student does everything. I'm there to guide them and teach them, but essentially, you are the ICU nurse for my patients that day. So please show up, be interested. When I move, you move. Keep that in mind. And keep it simple. You don't need to have a million things with you when you go to clinical. Maybe a snack, definitely pack a lunch. We have water in the unit, but if you want, you can bring a water bottle. Definitely bring something to write on because you're going to learn so much. It's great to have something you can put all that information and bring a pen and bring your eager excitement, your goal for the day, know what you can and cannot do, and speak up and tell your nurse what you're learning in class so that she can bring your knowledge full circle and apply it to your day. Guys, I know you're going to be successful in nursing school. Thank you for joining me, and I hope you enjoyed this video. If you did, let me know in the comments below. Definitely push that like button, and don't forget to subscribe. I want you to get updates and alerts whenever I post. I'm trying to post regularly. Be patient with me. I appreciate you, and always, you have no idea. I love you guys, and I love that you're making this channel possible. Till next time, I'm Tiana. Thank you. Goodbye.